The next software I want to talk about is the NIV software on the Puritan Bennett 980 ventilator. So you may have decided that you want to use non-invasive ventilation. It seems to be growing in popularity. And to do that, you may decide you want to use a mask on a patient. We know that masks have inherent leaks, and so how do we address those leaks? Well, let's go in and set up NIV on the Puritan Bennett 980 ventilator. I'll hit the vent setup button first, and then I'm going to go over to the NIV. Now in NIV you have a lot of options for modes that you can use. So you can use a syscontrol VC, syscontrol PC, SIMV PC, SIMV VC, and then probably most people will probably use spontaneous with a pressure support setting. So I'm going to start with, let's just say, maybe 15 centimeters here. I've got a PEEP of about 5, maybe I'll go to maybe like 12. And then I've got my sensitivity setting, O2 percentage. You have high pressure alarms as well. Disconnect sensitivities, you've got that as well. And this is going to reflect our leak sync software, so we'll get a better idea where we need to set that in a minute. You also have a spontaneous inspiratory time limit, so you can adjust that as well. And eSense, and a PEEP, as well as a rise time. And so I'm going to go ahead and accept those settings. And NIV is basically represented over here on the lower left-hand side. There's a little yellow, basically a display of NIV, which alternates with the spontaneous breath type that we're in. We can see that leak sync is automatically turned on as well. Now, to make this a little more realistic, I'm going to go ahead and create some leaks in the system. And we'll kind of monitor the breaths here. And I'm going to pull down my top display. And it gives me quite a bit of information here. So starting from the left to right, I've got a leak of 30%. Total leak per minute is 6.1 liters per minute. And that's going to help me set basically my descents. So I look at the absolute leak per minute, and then I set my descents above that relatively close. Then you have the absolute leak amount as well. So most importantly is this last number over here is spontaneous inspiratory time. So you want to make sure that that's a reasonable amount of time based upon your patient population size. So if it's a neonate, certain time for that, as well as with adults. In addition to this, if I go under the more settings area, you have the descents alarm, and this is the important one to make sure that you set appropriately. So based upon whatever the total leak rate was, and so we had the leak rate before, and I'll pull that down, and our leak rate is really pretty small right now. It's around 5 liters per minute. So that 5 liters per minute I'm going to keep in my mind, and when I set this alarm, I'm going to say, well, if it's only 5 liters per minute, I'll set this lower so that it will capture any kind of additional leaks that might be in the circuit. So with that, I'm going to move on to the actual alarms that you'll set. So let's go under the alarms. And you're going to set your traditional pressure alarms, rate alarms. You've got minute ventilation alarms, exhale total volume alarms, and spontaneous volume alarms as well.
So in summary, you will set all of your traditional alarms as well as your disconnect sensitivity or descents alarm based off of the total leak displayed.